So in today's lesson, we're going to do about why spatial inequalities exist. This is part of the OCR A-Level Spec 3.A, and I've highlighted the section it goes under. We've already talked about social inequality, and we're now going to look at patterns and maybe look at the causation behind some of them. So a really important factor that underlines a lot of inequalities is income. So if you cannot access goods and services because you don't have the money to be able to pay for them, then you are going to be severely disadvantaged. So that inability to be able to pay for things because you don't have the money will often put you in a different situation than the people who have a lot of money to be able to do that. So a couple of examples here that just relate to that. Your diet, housing and education can all rapidly be affected by low income. So often it's cheaper to buy processed food, and if you're trying to buy lots of healthy foods, that can actually be more expensive than buying kind of fast food and kind of processed food. Housing, it means that you have less choice, so you're often having to go for lower quality housing, which can, as I will explain later, have knock-on effects. And also you are going to have less resources personally for students, and therefore your education outcomes are going to be different. I'm going to talk about that in a little bit more depth, but it shows you that having low incomes underpins a lot of the problems that cause inequality. Where we have countries where there isn't such a gap between the rich and the poor, we often see less of these kind of problems occurring. It's not just wealth that we need to consider, we also need to think about disposable income. So if I have a higher disposable income, then I am going to have greater access to a variety of goods and services, but it also means if an issue like a recession happens, then I am going to be better protected because I can use some of that disposable income to actually pay for the bare essentials like housing and food and water, where some people who are on lower incomes with very little disposable income, as soon as any kind of economic shock happens to them, they are going to be pretty much backs against the wall. We can see on this map of disposable income that there is a north-south divide, and particularly those blue areas, which are the poorest areas, often seem to be in areas where there used to be heavy amounts of industry, like Birmingham, South Wales, Leeds, Bradford and Manchester. And we have to see a correlation between some of these deindustrialized areas where key industries like coal mining, manufacturing and shipbuilding have disappeared, and therefore the jobs have disappeared, and therefore there's been a massive impact on incomes. And so because there's lower incomes, therefore these people are going to suffer more of the consequences because of that. And another significant thing to consider in this is these are places that have had historically a lack of reinvestment. And so the cycle of poverty where people have low incomes, there aren't enough jobs and so are stuck on low incomes, and then maybe that happens a generation after, can continue to happen. Later on in the course we'll look at about how investment has happened in some places and the impact it's had in terms of regenerate and rebrand some of these locations. Education, we have spatial and big differences between groups in terms of education. This is a map of GCSE outcomes, 5 A stars to C, and it shows me that the south of England has 60% of students getting that, where places in the northeast and the north are getting closer to 55%. There is kind of causes behind this, but one of the major outcomes is that if you're from a poor family, you're often likely to get lower grades, GCSE and A-level, and the gap can be as much as 3 A-level grades, as this kind of recent article told us about it. There are some reasons behind that. Poverty and education are complex, but these are some kind of reasons why we get these spatial inequalities. So in poorer families, you don't often have the resources to pay for things that might improve your educational outputs. This can be, for example, books in the house, which means that children are reading from a young age and therefore will be better at reading and writing. Later on, it can mean that there are lack of computers so that students can work at home. Even the fact the size of your house, you might not have a place for a child to work and be able to do homework safely, and therefore that would reduce their educational outcomes. It says here the fact is that wealthy families are twice as likely to have 10 books in the house than most deprived, showing how they're more likely to have the resources to be able to benefit their kids' education. But it's not just money, it's also time. Often poorer families have to work longer hours to be able to make up those incomes, and therefore they don't have the time to engage with homework. They don't have the time to maybe attend parents' evenings, and therefore their child's educations can be damaged. Like I said, these are generalizations, but they can impact educational outputs. It can even get down to the idea of cultural capital. So wealthier parents are able to take their kids to the theatre, on holidays, to places that other poorer families couldn't, and therefore the kids get education from those experiences that poorer families might not be able to do. Housing is a really important factor. If the housing is built cheaply, like these tower blocks, they're more likely to be made with poorer resources, therefore they're more likely to get damp and mould, and that affects the kind of health of the residents. These were examples of social housing that were built in the 50s and 70s, and they were built very cheaply, often with things like asbestos, and because of that there were so many health problems that they kind of and social problems surrounding them that they often demolished in the kind of noughties and 90s. These are the Red Road flats, which were actually taken down in 2010, and they're in Glasgow. Another example of this is Grenfell Tower. This is in Kensington. This is an extremely wealthy area, but this was due to the local government refusing to properly insulate it with cladding, so it wasn't fireproof, and therefore there was a problem in the tower which caused 72 people to die. But largely this is because of inequalities. This is lack of government investment. And this is significant because this is an area of huge divide. So Grenfell Tower is one of the most deprived in the country, right next to places like Notting Hill, which are some of the richest. So we talk about the idea of inequalities being really close to each other, and it can be only a couple of factors. And here is the lack of investment in social housing that's caused that. In terms of LIDCs, this is simply a case of when the demand is higher than the supply, the poorest are often forced to worse conditions. So LIDCs often have lots of slums because rural to urban migration is so high, so there is not enough room of formal housing, so people are often forced into these terrible shacks. It doesn't just happen in LIDCs, we get inequalities in ACs. This is Hong Kong. Again, the housing costs are so high that some people have been forced to actually live in these rooftop slums because they can't afford normal housing. We also, back to the ACs again, we have like a divide between rural and urban areas. Sometimes we get people from cities and towns actually buying second homes. This is in the Highlands. The red areas are the areas of high percentage of second homes. And this is because people are buying them, and therefore that creates inequalities for rural people because they actually can't afford the homes in that area, because lots of people who don't live there have bought second homes, and that increases the price. So that pushes out rural people who have lived in that area for maybe generations. We're going to look at healthcare. There's a clear link between poor health and deprivation, as some of these things we talked about together, So housing, poor diet, poor access to medical services, and also things like lack access to green spaces. Sometimes you might live in an area with no area to go exercise. These all will add in to create poor health. It's kind of a deadly cocktail. It's not just those factors kind of combining, but it's also the factors access to medical services. So in some areas of the country, we might have higher rates of GPs per thousand, and that simply could be due to more investment. So London and South West have higher rates. We know the income levels are higher there, so they've got more investment in the healthcare system than perhaps some of the more deprived areas of the country. We can obviously see this on a global scale, and we see that LIDCs often have much lower rates of healthcare quality. This is in doctors per thousand, it's less than 1 for lower income. And again, lack of investment in facilities, but also lack of investment in education, no resources for education, so you get less university graduates, which means you're probably going to get less people becoming doctors, where we get the opposite happening in high income countries. However, this isn't always a perfect correlation. You know, even within wealthy areas, so Europe, Western Europe's very wealthy, but we see that the UK has, you know, between 2 and 3 doctors per thousand, where Norway and the Scandinavian countries have much higher. And, you know, there are causes for this. The Scandinavian countries pay more taxes, so they have more money spent on their healthcare system. And you could argue that's why they probably have more money to pay for doctors. Hence, we're going to get more doctors per thousand people. So there are factors that even cause spatial inequalities between rich countries. If we take this healthcare issue back to a more localized level, we can see that even in places where there is good healthcare, so Radley we can know is an area that is very underdeprived. It's in the lowest decile. That means it's one of the best areas in terms of the whole country, if we look at all those factors for deprivation. But because it's a very rural area, when I look at it in terms of access to GPs, it's actually one of the worst. And so that gives us the idea that even in countries where they have got very, very good access, so very good healthcare quality, it can actually be that access to medical services can be the factor. So if I don't have private transport or there's no good public transport, then living in Radley would be a significant hindrance to medical services. So rural areas often have poor access to medical services than urban areas. This also applies to other factors. So broadband's a really good example. We can see that there's a rural-urban divide in terms of something like a high-speed broadband. And I can see that Oxford is this yellow area. So the whole of Oxford has high broadband, 30 megabytes a second, where some of these rural areas, including Radley, have 0%. So again, we can see inequalities between rural and urban areas in terms of access to services, even in an AC country such as the UK.